I'm going to be giving my speech to these guys. So, all right, here we go. Stephen Lohr died on May 31st, 2017 in her home in Venice Beach, California, after going through a 12-year battle with stage 5 breast cancer. At age 30, a lump was found in her breast. A numerous number of doctors misdiagnosed her to start, but soon found out they were wrong. She soon started chemotherapy and it did not work. This is when she decided to take a more natural route and do cannabis oils, or marijuana, and it worked. Today I'll be talking to you about why the federal government should legalize the prescription use of marijuana. I have taken into consideration that many of you might have loved ones once or suffered from different types of sickness, and marijuana could have been the answer to making this better. What if every patient in America could be treated as effectively as Stephanie? Marijuana is one drug that could solve a lot of pain and suffering over a large spectrum of medical problems and can be an alternative treatment for patients. Marijuana has several medical benefits and very few side effects. Therefore, it should be legalized by the federal government for all American citizens to use as a medical treatment. All patients need to be provided with the best treatment options according to their own condition, which should include alternative treatments such as medical marijuana. Criminalizing cannabis prevents many patients from finding valuable treatment options, which actually violates the right of their health and safety. All men have certain rights, such as life, liberty, and pursuit of happiness, which cannot fully be given if the federal government keeps refusing treatments which can improve life for many patients. According to Medical Science Monitor, to deny a physician the right to discuss, recommend, and prescribe marijuana to patients is a direct violation of the physician-patient relationship. Patients can resort to the purchase of black market cannabis, which then puts them at risk of danger and getting in trouble legally. Cannabis has proven to be beneficially helpful to medical circumstances, although somehow it is forbidden to people who need it most. Medical marijuana is more effective treatment than other conventional treatments. Medical marijuana can treat a numerous amount of diseases. Cannabinoids, which is chemical compounds produced by cannabis, are what affects the body's molecular signals. Marijuana has been reported effective for medical use since production in 2090 BC. Cannabinoids can help treat symptoms related to AIDS, MS, epilepsy, and cancer. In a patent given to the American Department of Health and Human Services and states, cannabinoids have been known to be helpful neuroprotectants and help reduce the effects of Alzheimer's, Parkinson's, depression, and protects the brain against alcohol poisoning. Although prescription drugs do have high overdose rate, marijuana has no reported overdoses. Medical marijuana can combat the side effects of existing treatments. According to research done at St. George's University in London, some cannabinoids can not only kill cancer cells and slow their growth, they do not have the rather unpleasant side effects of the radiation due to chemotherapy, because they do not have effect on rapidly growing cells. Marinol is a drug that is legal. It is a form of the cannabinoid used to counteract all the side effects of chemotherapy and aid treatments. Marinol has been known to be ineffective, extremely expensive, and difficult for patients to consume. THC consumed through genuine marijuana plants has been reported a more effective way and less expensive compared to Marinol pills. Medical marijuana can be used without psychoactive effects. A study done by the Institute of Medicine concluded that the benefits of smoking marijuana were limited to the effects of the smoke, but nonetheless recommended that the drug be given under close supervision to patients. CBD is a chemical within the cannabis which counteracts the THC and is the main medical significance chemical within the plant. Medical cannabis can be administered in liquid form so that it's not harmful to the lungs, such as the case of the earlier lady we talked about. But what could happen if medical marijuana was available for people? Arguments have recently made that the use of medical marijuana would increase the recreational abuse of substances, that is a gateway drug, and could lead to the use of worse substances, therefore should not be legalized. Studies from the Institute of Medicine shown that even if marijuana is legalized, it will not increase the illicit drug use within the general population, nor would it influence the use of drugs. The goal of legalization is to take away the pain and suffering of patients in need of a form of relief, not to promote drugs. The role of marijuana as a gateway drug has not been proven true. The harm of smoke from marijuana use is outweighed by all the medical benefits, and the misinterpretation of legalization of cannabis can be reduced throughout schools. The federal government should legalize the use of marijuana for uses prescribed by physicians. Marijuana is classified as a Schedule I substance, which makes every possession of it illegal except for some research purposes. To legally obtain cannabis and make it an alternate treatment option, it would have to be classified as a Schedule II drug. Marijuana inhibits reaction time and death perception, making it illegal to drive, but other prescribed medicines have the same effects. This would still allow the government to regulate the use of the drug, and this will reduce the abuse. It will still be illegal to possess the drug without prescription, though. In conclusion, the use of marijuana comes with minimal risk, especially with the forms of availability. It can be easily regulated, reducing possible use for recreational purposes. Those with circumstances will improve from medical marijuana if given the choice and will no longer be left hopeless. Therefore, prescribing cannabis should be legalized for the general welfare of all American people.